Kelsey. I'm with Insurance Benefit Navigators, and I'm here to spread a little peace today. So we're a local family-owned insurance agency, and we represent multiple carriers, which is a big deal. We're not going to push you in one direction. We represent most in our area. My family's been in the health insurance industry for 3 generations, and I'm proud to carry on the legacy. They say that this time of year is always about keeping grounded and balanced, and at our office, we take that to heart. Our goal is to help people feel secure and confident about their health insurance, especially when it can feel very confusing and overwhelming. It is officially our busiest time of year, along with Medicare annual enrollment starting October 15th. Marketplace open enrollment starts Saturday, November 1st. This is when individuals and families can renew, make changes to their marketplace coverage for 2026. Anyone watch the news lately? So the good news is, as of Tuesday, we are able to quote 2026 plans. So we can start quoting, reviewing networks, and helping clients prepare their applications for 2026. However, there's one key thing to be aware of, and that's enhanced premium tax credits that were out for after COVID for the Inflation Reduction Act are now gone. So those are not currently reflected in our system and are still being debated on the federal level. So we can run quotes right now, and we are seeing those without those temporary subsidy increases that were set to expire at the end of this year. And those are still, like I said, being discussed at the federal level. The core subsidies, this is very important, of the ACA are still in effect. There's a lot of drama. The subsidies are going away completely. That is not true. These subsidies going away are enhanced subsidies. They did make insurance a little more inexpensive, but they are so far not available on our quoting platform. Meaning, of course, people can still receive financial help on their health insurance depending on the income and household size. We're focused on educating clients about what they qualify for as of today and staying ready to adjust if updates do occur. So this year, more than ever, people are confused, right? They've seen headlines about the shutdown, they've heard talks about subsidies ending, and they're not sure where they stand. Well, this is exactly where I come in. We're walking people through their options, explaining what's available now versus what could change, and helping them make decisions based on accurate and current information. Our approach is simple: no panic, no pressure, no politics, just clear guidance. At Insurance Benefit Navigators, we see our roles as educators first, whether it's explaining how enhanced subsidies worked and how the subsidies work now, or making sure someone's doctor is in the plan's network. We simplify what can otherwise feel very complicated. So I'm going to share a quick story from last year. I met with a family, stay-at-home mom, husband made, $150 grand a year, couple kids. They never really got the subsidy before. They didn't think they qualified. I got them, explained the situation. They did qualify for a subsidy, and they were saving about $1,000 a month on their health insurance, which is obviously a big deal for a family, especially with one income. Afterward, they let me know that this is the first time they actually understood how the marketplace works. For us, it's not about selling a policy. It's about helping people make confident, informed decisions about their health coverage. So how you guys can help. So we are looking for referrals for people who are individuals and families that don't get coverage through their job, self-employed professionals and business owners looking for coverage, young adults that are turning 26 and don't qualify on their parents' coverage anymore, and anyone experiencing a major life change such as marriage, divorce, new baby, or job loss. So if you hear someone say, my insurance cost is going up, I don't even know where to start, I don't know what's going on with the marketplace and the government and the shutdown, that's the perfect time to tell them, call the team at Insurance Benefit Navigators, and they'll make it simple for you. So even though things are a little bit different this year compared to the previous years, we're confident in the coverage that we're offering. We are confident that we have the most up-to-date information to share with our clients. And our motto is simple. So it's health insurance simplified. This open and annual enrollment, our focus is to focus on calm, clarity, and community. We're keeping up with updates as they come in and we're ready to help anyone who needs our guidance for coverage for 2026. So as you go about your week and you meet someone who might be unsure about their health insurance options, please remember peace, love, and coverage. And then send them our way. We'd love to take care of them. I have a little more time left than I expected, which is totally fine. But does anyone have any questions? I know there's a lot of confusion.
Can you sell in other states?
Yes, so thank you for asking that. I am licensed in the state of Georgia. We have a nice stronghold in the Savannah area, so we're pretty aware of the doctors and the networks up there as well. My mom's probably licensed in the most states, West Virginia, Ohio, New York, some other ones, but mostly Florida, Georgia is kind of the connection we're looking for.
Your family health plan, your kids turn 26, are they knocked off that automatically?
Exactly, so then they have to go on their own plan once they turn 27.
What are some qualifying events that someone can look at?
So do you mean to enroll outside of so the open enrollment period is November 1st till January 15th. Outside of that, and basically it's getting tighter now than ever on these regulations. They're gonna want proof of loss of coverage, which is fine, but basically let's say you quit your job, you're starting your own business, you lose coverage through an employer, that's a special enrollment period. Having a baby would be a special enrollment period. If you moved, but you would have to be covered from the state you moved in, if you were uninsured in Georgia and you moved here, that's not gonna count as a special enrollment period. But if moving causes a loss of coverage, it would then count as a special enrollment period. Yes.
For the self-enrolled business owner plan that you're talking about, is that just for the business owner, or would that include their family and kids?
Exactly. So you can do the family and the kids on the plan as well.
Okay, cool.
We also do Medicare, as many of you guys know. That season runs from October 15th to December 7th. That's that one time a year seniors can change their Medicare Advantage plans or go back to original Medicare or make any changes they want. We take a lot of pride in giving seniors their options, educating the seniors, being patient with our seniors, letting them leave our office and come back if that's what they feel they need to do. So any referrals for Medicare clients, self-employed people, we'd be happy. So thank you guys so much. Oh yeah, Medicare for all, man.